my name's Tristan. I'm going to be your nursing student for the day. I'm going to provide privacy as well as hand hygiene. So the doctor has ordered basically a full assessment. The only thing we're not doing is skin. So I'm going to start from the top and kind of work my way down. So if you can tell me your name and your date of birth.
Melissa, check out 053195.
Cool. So like I said, I'm going to try to start from your head and just work my way down. And I'm going to start by just asking you a couple of random and kind of weird questions, but it just kind of helps me gauge your neurological, where you're at neurologically. So do you know who the President of the United States is?
Yes, I did.
All right. And do you know where you're at right now?
House Medical Center.
And what's the situation? What are we doing right in this moment?
We're doing a head-to-toe assessment.
Head-to-toe assessment. Good job. And do you know what year it is?
2021.
2021. All right, cool. So neurologically, you're intact. You're alert and oriented ×4. And you do have a GCS of 15, and the way I know that is because your eyes can track me, they can move, you kind of follow the sound of my voice, which that is a score of 4. You are able to obey commands, so that's a score of 5, and then your motor function is intact, so that's a score of 6, which equals 15. So moving on, I'm just going to check we're going to start at the head, and your head is normocephalic. There's a non-traumatic, so I don't see any deformities or anything like that. I'm just going to palpate your scalp and make sure there's no tenderness. So let me know if you feel any pain. All right, so there's no tenderness or deformities noted. And next I'm going to go down to your ears. So your ears are symmetrical on both sides. There are no deformities. They're not abnormally large or abnormally small. And next I'm going to go to your eyes. So what I'm going to do is I'm going to use this pen light. I'm going to test your accommodation as well as I'm going to look at your pupils. So accommodation, I'm going to hold this up about 4 to 5 inches from your face, and then I'm going to move it closer, and I'm just going to make sure your eyes are able to track it, okay? All right, so hold it about 4 to 5 inches. Move it forward. All right, so accommodation is intact. Next, I'm going to look at your pupils. So looking right now, your pupils are about 5 millimeters. And now I'm going to shine the light into them and make sure that they react to it, okay? All right, sweet. So her pupils are round, equal, reactive to light, as well as to accommodation. So that is normal. Next, I'm gonna, if you don't mind pulling down your mask, next I'm gonna look at her nose. Her nose is symmetrical, there's no deformities noted, and I'm gonna check for patency as well. So if you'll close one side and then take a blow out real hard, all right, and do the same thing to the other side. Sweet. So both of the nares are patent, and next I'm going to move down to the mouth. So I'm going to get her to open her mouth, make sure her gums are healthy, her teeth are white, glossy, mucous membranes are moist, and as well as evaluate the throat. So if you just open real wide for me. All right. So her mucous membranes are moist, which is a normal finding. Your teeth are white and glossy. The gums look healthy. There's no lost teeth or your teeth don't look rotten or anything like that, so that's good. Next, I'm going, also your throat. The throat was, there was no redness, no swelling noted as well. Next, I'm going to check to make sure your trachea is midline. You can pull up your mask. Make sure your trachea is midline, so I'm going to hand you this fake cup of water. I'm going to get you to take a sip, and I'm just going to feel. All right, so your trachea is midline. I don't feel any deformities there. So now I'm just going to ask you a couple questions about everything we just went over. So are you experiencing any headaches?
Nope.
Any vision loss or blurred vision?
Nope.
What about hearing? Is your hearing intact? Has it been kind of off lately?
No, my hearing's good.
All right. What about your nose? Any congestion, nasal drainage? Anything with your mouth pain-wise?
Nope.
And throat, all good?
Yes.
Sweet. All right, so next I'm going to move on down to cardiac and respiratory assessment, which I'm going to check her pulse and respiratory rate, so if you don't mind laying back for me. All right, and I'm going to start with feeling a pulse. So I'll listen for a minute, and your heart rate is 72, and your respirations are 18. So the way I got that is I felt for a pulse for 30 seconds and felt for a respiratory rate for 30 seconds and multiplied by 2. Excuse me. And so now I'm just going to listen to your heart and lung sounds, make sure everything sounds good in that area, okay?
Okay.
All right, so I'm going to start off by listening to your heart. And then I'm going to flip my stethoscope over to the bell side of it. That way I can listen for any murmurs. Alrighty. So there was, I didn't hear any murmurs or anything like that. Your heart sounds good. So next I'm going to listen to your breath sounds. So I'm just going to place my stethoscope in 4 different parts on the front side, your 2 lateral sides, as well as 4 spots on your back. And I'm just going to make sure there are no crackles, any abnormal breath sounds heard, okay? So every time I place my stethoscope, just take a deep breath. If you feel dizzy or anything, just let me know, and we'll stop and take a break, okay?
Okay.
All right, so a deep breath. All right, I'm gonna reach over you. All right, if you can sit up for me, we'll get your back. All right, deep breath. All right, last one. All right, sweet. So your breath sound normal. There are no adventitious lung sounds or anything like that. Same with your heart. So are you experiencing any short of breath or any chest pain at this moment?
Nope.
No? All right, sweet. And I did feel your pulses. They are normal 2+. That's a normal finding, is to be expected. As well as I am just gonna, if you'll prop your feet back up, I'm just gonna feel the top of your foot, which these shoes work out well because you don't have to take them off. To make sure you have pulses present in both sides. And you do. And I'm also gonna check for any swelling. And there's no swelling noted on any of the extremities. I'm also going to check for capillary refill, which is also present. So cardiovascular wise and respiratory wise, it's looking good. Nothing to be worried about there. The next assessment I'm going to do is your abdominal assessment. So during this moment, I would ask my patient to pull up their shirt, but we are in a hospital and we're at work, so I'm going to skip that part. So I'm just going to auscultate the 4 quadrants of the abdomen, starting in the right lower quadrant, and then I'm going to palpate to make sure there's no rigidity or tenderness. Okay. So I'm going to start off by auscultating, and we're going to start in the right lower quadrant and go up. And then now I'm going to flip it over to the bell side to make sure I don't hear any aneurysms or anything like that, okay? And I'm going to listen right up under the xiphoid process. All right. And there were no abnormal findings there. She has normal active bowel sounds. In a clinical setting, I would listen to the bowel sounds for 1 minute each in each quadrant. But since we're doing a 15-minute video, there's not much time for that. So next I'm going to palpate. Just let me know if there's any tenderness or anything like that. I'm going to start out lightly, then I'm going to get a little bit, palpate a little bit deeper, okay? Any tenderness?
Nope.
No, you're good? All right, so I'm going to go just a little deeper. Is that good?
Yep.
All right, sweet. So there's no tenderness or rigidity noted. So the next assessment we're going to do is a musculoskeletal assessment.
Okay.
So we're gonna check out the elbows and the wrist of the upper extremities and the knee and the foot of the lower extremities. So if you'll just sit on the edge of the bed for me. So what we're gonna do is I'm just gonna grab a hold of your elbow. I'm gonna get you to flex and then extend your elbow, and I'm gonna feel, and if there's any pain, just let me know, okay? So go ahead and flex, and extend. All right, so there's no crepitus noted, and the patient did not inform me of any pain. So I'm gonna move to the next one. Same thing, flex, and extend. Once again, no crepitus noted. And I'm going to do the same thing with the wrist, okay? So we're going to start off by we're going to flex it, we're going to extend it, then we're going to hyperextend, all right? So start off with the flexing, extend, hyperextend, all right? To the next one, flex, extend, and hyperextend. Same thing, normal findings, no crepitus or pain with movement. Then we're going to go to the knees, and we're going to do the same thing. And we're going to flex and extend. Just kidding. We're going to extend and then flex. All right, and let's do the same thing over here. Extend and flex. One more time. Extend and flex. And then you're going to kind of fight me. Okay, so I'm going to push down, and you're going to push up. All right, same thing. All right. All right. And actually, I did forget to do that up here too, so I'm just going to try to pull against me. And then push away. Pull against me and push away. Sweet. And lastly, we're just going to do your foot. So we're going to flex, or plantar flex and dorsiflex. So we're going to dorsiflex and plantar flex. All right. So for the musculoskeletal, there are no abnormal findings. The next thing we're going to do is I'm going to get you to stand up. And we're going to do a Romberg's test, which is going to test for your balance, okay? So all you're going to do is you're just going to close your eyes, and you're just going to try to stand still, okay? And I'm going to just put my arms out just to make sure if she does have an unsteady stance. Sweet. So there was no swaying or anything, so she has a negative Romberg's test. And lastly, I'm just going to get you to walk over there and then walk right back. And we're going to evaluate your gait. Sweet. So you can have a seat. Her gait is steady, and there were no balance issues that I saw. So I'm just going to ask a couple more questions, and then I'll be out of your hair. We'll be good to go. I'm also going to inform you of this. So I didn't ask, are you experiencing any abdominal pain?
Nope.
What about any pain with your extremities, like with movement or just like an achy pain, anything like that?
Nope.
Sweet. All right, so this right here is called an incentive spirometer. Since you are going to be here for a while, we just want you to take some deep breaths and blow into this every 10 times per hour. The reason we do that is it's going to expel some mucus. It's going to get anything that's been settling. It's going to get it up, and you're going to be able to hack it out. And as well as kind of try not to stay in the same position, because when you do that, the mucus can settle in your lungs, and then it can lead to further things that we don't want. So if you'll use this incentive spirometer, you'll be good. But everything's looking good from my standpoint. We'll let the doctor know, and if you have any questions, please feel free to reach out to me. I'm gonna be here all day. So you good? You have any questions now?
Nope.
Sweet. Thanks, Alyssa.
You're welcome. I'm the best patient.